Promise. Hi, my name is Jen Loki. It is November 8th. This is my 15-year-old Kai. And he is going to model some things for us today, some surface anatomy landmarks. The first thing is the zygomatic arch. So it's the prominent part of his zygomatic bone that is part of the skeletal system, cheekbone. The next thing is his thyroid cartilage, which is part of the respiratory system. And it is, go ahead and swallow. There we go. The top cartilage right superior to the cricoid cartilage down below. So thyroid cartilage right there. Next, we have the head of his ulna right here. Nice little lumpy. So head of his ulna, part of the skeletal system. The next thing we have is the tendon of the flexor carpi radialis. So that is, let's see if we can make this computer see this. So it's this tendon right here, and that is important for a reason we'll talk about in just a second. And that tendon is part of the muscular, I think considered just part of the muscular system. And let's see here. And then we have the tendon of the calcaneal tendon, so Achilles tendon. And so we're going to take this computer down here and show it. Let's see. Can we see it? Is it there? Yeah. So it's this back sort of protuberance on his heel above the calcaneus bone. The calcaneal tendon would be part of the muscular system as well. And the two of these 5 surface anatomy landmarks that I will be dealing with in my future career as a physical therapist are the calcaneal tendon is a great place for locating that and then going distal to that, so toward the thumb, and finding a quick radial pulse. Just in case, I don't know if physical therapists ever need to figure out a pulse, but I imagine working with athletes, I would probably need to check their resting pulse versus their active pulse or something like that. But this is just a quick, like non-invasive place to do that. So I would think that is nice. And then the other one that I will probably deal with a lot as a physical therapist is the calcaneal tendon. I personally had Haglund's deformity and had to have a bone spur shaved off underneath my Achilles or calcaneal tendon, and then have it put back together. And I know that that's common, not necessarily Haglund's deformity specifically, but a lot of Achilles issues are common with runners. And just, it seems like athletes in general. It's a really avascular area, so there's not a lot of blood flow, and therefore it takes a long time to heal, it seems like. So as a physical therapist, I imagine I'd be doing some dry needling down there to promote blood flow, maybe some E-stim, and certainly some stretches and possibly like scar tissue massages. I had a lot of those and they were really painful. But as a physical therapist, I'm betting that I'm going to be dealing a lot with the calcaneal tendon. So those are the two that I probably will work with in my future career. I mean, honestly, as a PT, there's a whole lot that I can see working with, all of the joints that bother people when they overuse them. But those are the two that I chose. So there you go.